Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are doing an infection question drill set. So if you're new to these question drill sets, what you can expect is we will pull up a question, read it to you guys, give you about 30 seconds to answer, and then we'll walk through why the correct answer is right. We hope you'll engage with us in the chat. We have Nurse Samantha moderating the chat for us today. So be sure and say hello to her, ask her questions along the way. And before we get started, make sure you're following us on your favorite social media channel. We have tons of great live and on-demand content, so we're glad to have you be here, glad to have you with us today, glad you're part of our UWorld nursing community. All right, let's go ahead and get started. Question 1. The nurse in the emergency department has collected information about clients waiting to be seen. The nurse should first assess the client who has option 1, epistaxis and takes aspirin, option 2, dysuria and takes tamsulosin, option 3, vomiting and reports frequent loose stools, option 4, persistent cough and reports night sweats. All right, 30 seconds on the clock. Drop those answers in the chat. While you guys are answering, I'm going to hop into the chat myself so I can see what you guys are thinking, any questions you might have. And again, if you guys are just joining us or just logging on, we are covering infection questions today. So we'll talk through different infection prevention measures, different medications, different contagious conditions. And so we'll kind of walk through it that way. But we're glad to have y'all with us. All right. I've got my chat open, just waiting to see what's coming through. But good work, you guys. All right, awesome. Well, our correct answer in this one is going to be option 4, persistent cough and reports night sweats. So well done to everybody. But let's start with the question. What we see in the question, we see that word first bolded. This is going to indicate that this is a priority question. So we're going to use some of our prioritization strategies. We can focus on kind of the basics, airway, breathing, circulation. After that, we're going to prioritize safety and infection. And that's kind of where this question falls. Like some of these findings aren't like overly concerning when we read them. So we kind of have to go to like our tier 2 prioritization strategies. So we're going to focus on safety and infection. But we can see a little bit of emergent stuff with a persistent cough, but let's walk through what else we have going on here. So what is being described in option 4 is tuberculosis, or what could be tuberculosis. So we know TB is highly contagious and it's spread through airborne droplets. Or it's spread via airborne. So airborne is essentially like the inhalation, exhalation, just breathing can spread it. What we would think of with droplet precaution would be like a sneeze or a cough, something more kind of like aggressive coming out of our mouth versus just inhaling and exhaling. So if we see a client that has persistent cough, reports night sweats, we can immediately be kind of alarmed that we might have tuberculosis going on. This is going to be who we're going to prioritize because we want to kind of make sure we're not spreading this around to other people, implementing those correct infection prevention measures and going about it that way. What we see in option 1, epistaxis and takes aspirin, this is essentially a bloody nose. We know aspirin is an antiplatelet medication, so our client's going to be at risk of bleeding. A bloody nose, you know, as long as it's stopping, it's nothing persistent, we can definitely treat this person, make sure that there's nothing more alarming going on, but for right now, we're okay with this. Option 2, dysuria and takes tamsulosin. This is going to be maybe something we would see with BPH. So tamsulosin is a medication we use to treat BPH, or benign prostatic hyperplasia. We can have some dysuria or pain with urination with BPH, maybe something that's progressing to a urinary tract infection due to some urinary retention. But again, not the end of the world. We're definitely going to treat these people, but we need to prioritize infection prevention and the spread of infection. Option 3, vomiting and reports frequently loose stools, maybe some gastritis. Definitely want to do further testing, provide supportive measures, but again, we want to make sure and provide care to our client in option 4 and protect other clients from a possible TB infection. Good job, you guys. All right, moving on, question 2. The nurse is preparing to administer vaccines to assigned clients with HIV infection. Which of the following vaccines should the nurse hold for clarification prior to administering? Option 1, pneumococcal conjugate vaccine. Option 2, human papillomavirus vaccine. Option 3, hepatitis A vaccine. Option 4, varicella vaccine. All right, let us know what you guys think. Hello to our viewer who it's 4 a.m. in the Philippines. Thank you for being so committed to UWorld Nursing. That is so great to have you here. Let us know where you guys are joining from. We love to see where around the world we're reaching you guys. It's so great to have you all on today. And after you let us know where you're coming from, let us know if you guys are taking your NCLEX soon. Let us know when your test date is, or if you found out that you've recently passed. We love to celebrate you guys, wish you good luck. That's probably our favorite part of doing these lives, is seeing everyone celebrate their big wins. And you guys support each other in our community too, wishing each other good luck for your test date. All right, good work, you guys. Okay, our correct answer in this one is going to be option 4, varicella vaccine. So kind of looking at what the question is asking, we see which of the following vaccines should the nurse hold for clarification. This is essentially like an intervene question. So our correct answer is going to be the incorrect option. So we need to kind of put these pieces together. We have a client with HIV. We know they're going to be immunocompromised. We know they're going to have a suppressed immune system. So we want to avoid live vaccines. We know out of these options that option 4, the varicella vaccine, this is a live vaccine. So this is going to be our correct answer. We don't want to give this to the client, so that means we need to clarify it, kind of stop the line, make sure it's not given to the client. What we see in options 1, 2, and 3, these are safe to give and appropriate to give. They're going to help prevent any opportunistic infections for a client that maybe is immunosuppressed. We want to make sure that they have as much of a chance to fight infection with these vaccines, or have a lower response to these infections should they happen. So good work on that one. All right, question 3. The nurse is caring for a client with hepatitis C. Which of the following actions should the nurse take? Select all that apply. Option 1, instruct housekeeping staff to use bleach products to clean surfaces in the client's room. Option 2, monitor the client's laboratory test results for a prolonged PT and APTT, activated PTT. Option 3, instruct the client to use condoms when engaging in sexual intercourse. Option 4, request a prescription for lactulose for the client. Option 5, monitor the client for jaundice. All right, 30 seconds on the clock. Drop those answers in the chat. Oh, good luck to Jennifer, who has a job interview tomorrow. That's really exciting. We have some cool videos on our YouTube channel about kind of how to be prepared for an interview. So if you want to check it out, we hope it can be helpful. But congrats on passing your NCLEX. And good luck to, I think it was Queen Bee, who's maybe getting ready to take your NCLEX. Good work, you guys. Awesome, awesome. And if you guys are just tuning in, we're covering infection questions. So we're talking all things infection prevention, treatment, management, all of that. Good luck to Lucia, who has your test coming up on the 11th or the 10th. It went by too fast, I missed it. But good luck. Awesome work. Amanda is taking her NCLEX on Monday. You've got it. Good luck, good luck. Make sure you just kind of take a break before, so your brain can file away all that information and you can get ready for your test day. All right, good work, you guys. Our correct answers are going to be options 2, 3, and 5. So again, we're talking about a client who has hepatitis C. We're looking for what actions they should take. So this is a pretty straightforward kind of plan of care question. What kind of things are we going to expect to tell a client, or what are we going to expect to do as a nurse caring for a client that has hepatitis C? So hepatitis C is a bloodborne pathogen. It's going to infect the liver. So we're going to worry about our liver becoming compromised. So it's kind of going to be like our theme as we talk through all of this. So since the virus infects the liver, we're going to worry about liver function, and we're going to want to monitor some of these kind of like liver function tests kind of. So what we see, option 2, monitor the client's lab tests for prolonged PT and activated PTT. What these values are going to tell us is how long it takes our blood to clot. If our liver is compromised and we have prolonged PT and APTT, that means we have an increased risk for bleeding. It's going to take us longer to clot if we develop a bleed somewhere. So we definitely want to monitor this. This is going to be an indicator of liver function. We appreciate prolonged PTT and a prolonged APTT are going to indicate we have worsening liver function. So we definitely want to monitor that. Option 3, instruct the client to use condoms when engaging in sexual intercourse. We definitely want to educate these clients about protection and protecting others from spreading hepatitis C. And then option 5, monitoring the client for jaundice. Jaundice is going to indicate worsening liver function. Jaundice is going to be, we'll notice it as manifestations like changes in colors in the sclera of our eye, changes to our skin color, like maybe a little bit of a yellowing or orange kind of color. We can also see it in our mucous membranes as well. So this is going to indicate worsening liver function as well. What we see in option 1, instruct housekeeping staff to use bleach products. This isn't necessary for management with hep C or for infection prevention of the spread of hep C. This would be something we would do for C. diff. That bleach is essential to kill that bacteria, but not essential for hep C. And then what we see in option 4, requested prescription for lactulose. Lactulose isn't going to treat hepatitis C. It can be a treatment or management for hepatic encephalopathy or any type of buildup of ammonia in the blood. So when our liver starts to fail, we'll have a buildup of ammonia. When we have too much ammonia in our blood, we can kind of see it manifest itself as changes in our neurostatus. So maybe some confusion, other things like that. And that would be when we would use lactulose. But lactulose isn't going to treat hepatitis C. We use it to treat a buildup of ammonia. So good work on that one. You guys did great. Again, our correct answers are 2, 3, and 5. All right, question 4. The nurse is screening clients for those at risk for developing influenza. Which of the following findings should the nurse recognize as a risk factor for influenza? Select all that apply. Option 1, consumes a plant-based diet. Option 2, history of type 2 diabetes mellitus. Option 3, resides in a long-term care facility. Option 4, receives hemodialysis 3 times per week. Option 5, takes methotrexate for rheumatoid arthritis. All right, drop those answers in the chat. Let us know. All right, good work, good work. And let us know too if you guys, if this is your first time joining one of these lives. We always tell our first time viewers to come kind of sign in with us at uworldnursing.com. It's really kind of our home base for all things UWorld Nursing. You can subscribe to our event calendar so you can kind of see a couple weeks in advance all the different content we're going to be covering, what channels we'll be live on, what time we go live, all that good stuff. We also have other ways you can kind of join into UWorld Nursing through our question of the week. So you'll get an email once a week with an NCLEX styled question. You can answer it. It'll take you to kind of a full UWorld explanation, which is really what makes UWorld so special and so effective. We'll walk through why the correct answer is right, why the wrong answer is wrong, maybe what made it distracting, what would make it right, all that good stuff. A lot of active learning happens with our explanations, and what is really stands out too is just our illustrations and animations, all those other ways of kind of engaging with content. So we hope you'll check it out. Awesome, awesome. All right, our correct answers on this one, a lot of correct answers, are going to be options 2, 3, 4, and 5. So again, a straightforward question. We're just looking for risk factors for developing the flu. So again, we don't have to overthink it, but when we do see select all that apply, those words will be bolded. Pay attention to any time you see a bolded word like that. It's going to alert you to, with select all that apply, that you're going to have more than one right answer. So we're going to take these, we're going to go through them one at a time. We don't ever typically compare select option choices against each other and select all that apply, maybe like we would in a prioritization question. We're going to let them stand on their own and just say if it's true or false to what the question's asking us. So when we're talking about flu, a lot of what's going to be kind of the woven theme with all of these option choices is either going to be clients that maybe have, that are immunosuppressed, like have a suppressed immune system, are taking immunosuppressant medications, or they're in an environment that promotes the spread of pathogens or being in close proximity to others. So we know the flu is so catchy, it's so easy to spread it amongst people, but when we have some of these underlying conditions, that can make it a little bit harder. So option 2, a client with type 2 diabetes. these clients can have a suppressed immune system. They can have a harder time overcoming viral illnesses. Definitely going to be a risk factor for the flu. Option 3, residing in a long-term care facility. These clients are in close proximity to a lot of clients and kind of at a lot of different times during the day. So a high chance for flus kind of developing and spreading amongst clients in a long-term care facility. Receiving hemodialysis 3 times a week. A lot of times clients with hemodialysis are going to be on those immunosuppressant medications, definitely going to increase our risk. And then option 5, taking methotrexate for RA. So methotrexate is an immunosuppressant medication. RA is a autoimmune condition, and so a lot of treatment for those autoimmune conditions is to decrease the immune system, decrease that immune response to those triggers for those conditions. So those are our correct answers. Option 1, consuming a plant-based diet, definitely not going to increase our risk for the flu, maybe even help us fight the flu with all the good vitamins and nutrients that come from a plant-based diet. All right, well done, you guys. Question 5. The nurse in the urgent care clinic has taught a client with newly diagnosed streptococcal pharyngitis. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. Option 1, I plan to place a humidifier in my bedroom. Option 2, I should contact the clinic if my urine color changes. Option 3, I will receive a prescription for an antiviral medication. Option 4, drinking cool citrus juices will be soothing to my throat. Option 5, gargling with a warm saltwater mixture may alleviate my pain. All right, good job, you guys. Well done, well done. Let's see what you think. Good work, you guys. Oh, and yeah, there's maybe a question about how select all that apply questions are scored. I never really envisioned myself saying this at my current age, but back in my day, when I took the NCLEX, it was kind of like an all right or an all wrong situation. But now, select all that apply questions, you receive partial credits. So what you get right counts for you. What you get wrong or what you miss answering doesn't count against you. So it's kind of like, you can think of it like 1-0 scoring. So a good time to be an NCLEX test taker. But good work, you guys. I'm seeing a lot of 3 5s, 1 5, 1 3 5s, 1 2 5s. Good work, good work. All right. Thank you all so much for being here. Again, I see kind of a big jump in our viewers, so we're glad to have you all with us. Be sure you guys share this session, invite your friends. The more the merrier, and be sure and follow us. We'll have this posted on all of our channels later today, so you can go back and practice. All right, our correct answers on this one are going to be options 1, 2, and 5. So in general, this question, pretty straightforward. We're looking for correct understanding. That means our correct answers are going to be true statements. So these are all kind of teaching statements. So we can just say, is this true for the condition or is this false? But what we have going on here is strep throat. So we are looking for supportive measures and appropriate instructions we should teach a client with strep throat. So strep throat, again, is a bacterial infection going to manifest in our throat. We're going to treat it with antibiotics, and we're also going to treat it with supportive measures. So think about like pain, pain management measures, hydration, comfort measures, things like that. Okay, so option 1, a humidifier. This is going to help with that pain associated with strep throat. The humidified air, when we breathe it in, it's going to be more soothing on our airway versus air that's not humidified. So this can just, again, this is a comfort measure, something that's a true statement. It's not wrong to do this. We would support this. Option 2, I should contact the clinic if my urine color changes. This is definitely a true statement, something you definitely want to drive home with your clients that maybe have strep throat. So what this is describing is acute post-streptococcal glomerulonephritis, which is a big mouthful, but essentially what it is when a strep throat infection kind of makes its way from our throat down into our kidneys. So that strep infection travels into our kidneys, and essentially we have a strep throat in our kidneys. So what is going to happen is going to cause kidney injury, and we will have changes to our urine color. So maybe tea-colored urine, cola-colored urine. So we definitely want to be sure the client knows to look out for this, and if they see it, they know to immediately notify the healthcare provider. This is something that needs immediate intervention, immediate care, because it can lead to acute kidney injury, which we know down the road can be fatal to a client or cause a lot of complications. Definitely a big one to drive home. Feels a little drastic compared to the humidified air, but both important for a client to know. Then option 5, gargling with warm salt water may alleviate pain. This is a true statement. Again, falls under the kind of umbrella of comfort measures. What happens with salt water and why it's important to tell clients to do this, we're going to have a lot of pain and inflammation with strep throat. When we gargle with salt water, it's kind of like an osmosis situation that's going on. So that high concentration of sodium in our salt water and the swelling that's in our throat, it's going to kind of pull that fluid out of our throat and help reduce that inflammation. The warm's also going to feel comforting on a sore throat as well. So that kind of goes hand in hand. It's going to help with pain relief, help decrease that swelling, and help provide more comfort. What we see in option 3, this is incorrect. So we talked again, strep throat is a bacterial infection. We wouldn't give antiviral medications for it. We would give antibiotics. And then option 4, cool citrus juices is not going to feel good. Maybe the cool part, but the citrus juices, it's too high in acid concentration, too acidic. That's going to burn our throat. We definitely don't want to do that. Cool liquids are good, just not cool acidic liquids. All right, well done, you guys. Moving right along, question 6. The charge nurse is reviewing client care assignments for the next shift. The charge nurse should intervene if a nurse who is pregnant is assigned to care for a client with option 1, cytomegalovirus infection who is receiving ganciclovir, option 2, sepsis who is receiving IV vancomycin, option 3, myasthenia gravis who is receiving IVIG, option 4, cirrhosis who is receiving lactulose therapy. All right, drop those answers in the chat. Well done, you guys. I see maybe a lot of people that are past your NCLEX. Congratulations, that's so great. You'll have to share with the chat your #1 study tip. We love to see what those are for everybody. And we also like to ask how you guys are studying. Do you guys like doing these live question reviews? Do you like lectures, flashcards? Is UWorld part of your study kind of like toolbox? Are you guys already using UWorld? Let us know. We love to know what's most effective to you guys, how you like to learn. We're always taking that feedback so we can better serve you guys, better improve what we do for you all. I see some people are already using UWorld. That's awesome. Great to know. Well done, you guys. Good answers coming in too. I see some option 1s. And if you guys know the classification of kind of what we're about to explain about this question, put that in the chat too. Let us know if you know that. All right, good work, you guys. Okay, so what we see in this question, our correct answer is going to be option 1, cytomegalovirus infection who's receiving ganciclovir. So there's some pretty important information in our question. So we see a pregnant, we know we have a nurse who is pregnant. So we need to know that there's certain measures that need to be implemented to protect pregnant nurses when caring for clients with certain conditions. So we're going to talk kind of broadly about torch infections, and that's where CMV or cytomegalovirus falls in. So CMV is part of torch infections. I'll go through what they all stand for. So T is toxoplasmosis, O is other, which includes parvovirus, varicella zoster, parvo and varicella zoster. The R is rubella, C is cytomegalovirus, and H is herpes simplex virus. So CMV can essentially be, if in a non-pregnant client, it can maybe not make much of a difference caring for this client. But for a pregnant client, that virus can be harmful to the fetal client. So we definitely want to make sure that this nurse isn't caring for this client, that the client's being assigned to a non-pregnant nurse. So CMV in the fetal client can cause deafness. So other things we need to protect pregnant nurses from, in addition to certain viral infections or different infections, would be certain medications. So ganciclovir is not an appropriate medication for a pregnant nurse to give. Additionally, we wouldn't have a pregnant nurse give medications like chemotherapy or anything like that that can cause harmful side effects, again, to that fetal client if they're exposed. So pay attention to what that question's asking. Make sure you read all those words. The NCLEX is so specific about the words they choose. So if you see that word pregnant nurse in there, know that's in there for a reason, and kind of think some of those safety measures that need to be taken while working and being pregnant at the same time. All right, good job, you guys. Oh, I guess let's go back through the other ones. What we see for the rest of them, some of these, they're all appropriate for a pregnant nurse. So sepsis, who's receiving IV vancomycin, appropriate for a pregnant nurse to give IV vanc. Sepsis is essentially an infection in our bloodstream. We're not worried about anything contagious at this point. Myasthenia gravis, who's receiving IVIG. IVIG is safe for a pregnant nurse to give. And then cirrhosis, who's receiving lactulose, also safe, all good, all compatible with a pregnant nurse. All right, good job, you guys. Okay, question 7. The nurse is caring for a client with varicella who has open lesions. Which of the following infection control precautions should the nurse implement? Option 1, wipe down all surfaces with bleach before exiting the client's room. Option 2, place the client in a semi-private room with a client who has pertussis. Option 3, limit visits by the client's family members to 1 30-minute visit per shift. Option 4, put on a N95 respirator mask, protective gown, and clean gloves before entering the client's room. All right, 30 seconds on the clock. Drop those answers in the chat. Good job, you guys. Well done. I'm seeing a lot of option 4s come through already. We hope you guys, again, will follow us on your favorite channel at UWorld Nursing. We have so much great content headed your way every single week. We go live 5 times a week. You can find our schedule on uworldnursing.com. Yesterday, Samantha did an awesome lecture on ABGs, which are super challenging. She really broke it down to make it easier to understand what it means to be in acidosis versus alkalosis, respiratory, metabolic, how our body works together to kind of compensate lungs versus kidneys. So we hope you guys will check that out if that's a tricky subject for you. Our whole tagline at UWorld is we make really hard stuff easy to understand, and that's what we try and do with some of these challenging topics. So we hope you'll check it out, and then again we'll go live again tomorrow at 11 and 3 p.m. as well, so be sure and come back. All right. Our correct answer on this one, you guys got it, is option 4. Put on an N95 respirator mask, protective gown, and clean gloves before entering the client's room. So we see varicella, but not only varicella, we see open lesions. So that means varicella is in like its prime time. It's extremely contagious when we have those open lesions. So we need to implement airborne precautions, and we also need to implement contact precautions. So we'll see that N95 mask, which represents our airborne, and then we'll also see the contact precautions, which is our gown, gloves, all of that to make sure, especially with open lesions, that we're protecting ourselves from any secretions. So this is exactly what we need to do for this, this client. This is appropriate, follows all the rules. This is what we need. What we see in option 1, this would be something, again, we would do for C. diff. You need that bleach to interact with the C. diff bacteria. That's going to help prevent the spread of the bacteria outside of the client's room. Option 2, we definitely need a private room for a client that's on airborne precautions, negative pressure room that's going to take the air out of the building, not circulating it back. And then pertussis is also extremely catchy, so we're going to end up, if we have a shared room, we're going to have someone getting varicella and pertussis together. We don't want that. Those two won't mingle well together. And then option 3, limit visits. We don't need to limit visits. We just need to either follow your facility protocol or educate that the visitor of appropriate measures they need to take when going in the room. But good job, you guys. All right. Last question. The nurse has attended a staff education program about the prevention of central line-associated bloodstream infections, or CLABSIs, in clients with a central venous access device, or a central line. It would indicate a correct understanding of the program if the nurse, option 1, assesses the CVAD insertion site and dressing once every 24 hours. Option 2, disconnects the IV tubing from the CVAD when changing the client's gown. Option 3, changes the transparent CVAD dressing every 5 to 7 days or when the dressing is soiled. Option 4, scrubs the CVAD insertion site in a circular motion using an alcohol swab while changing the dressing. All right, 30 seconds on the clock. Drop those answers in the chat. Good job, you guys. Well done, well done. I had someone maybe ask a question about the kind of difference with droplet versus airborne. I always remember airborne is like breathing, so just in and out breathing, and then droplet is like the forceful kind of like expelling of a secretion like a cough or a sneeze. So you kind of have to have something with force to get a droplet out of your mouth versus airborne is just breathing in and out. Kind of like that aerosol air is airborne, and then droplet is like a sneeze or a cough. But that always helped me. Those are tricky though. It's hard to, I think I do remember that was the very last thing I studied before taking my NCLEX, was making sure I had all of my conditions that fell under the right precautions and making sure all of that lined up. And UWorld has amazing illustrations to, it kind of outlines what you need to put on as a nurse, what conditions, what to look out for, all of that. So those can be extremely helpful. You can put them on a note card, review them. We hope that can be helpful. All right, good job, you guys. All right, so our correct answer on this one is going to be option 3, changes the transparent dressing every 5 to 7 days, or when the dressing is soiled. So CLABSI prevention is a huge part of working as a bedside nurse, especially in an acute care setting like a hospital. That's a really important measure for hospitals to keep patient safety numbers high, and also, of course, we want to keep our patients safe as well. But that's something you'll be versed on, have to sign off on very frequently as when you're a bedside nurse. So it's important to know all the appropriate ways when you're interacting with a central line. So central lines, essentially, they can be in multiple different locations. They're called different things. You can have ports, PICC lines, all sorts of lines, but essentially a catheter is strung through a big vessel, and that catheter goes all the way to our heart. So it's fed all the way through to our heart, and that it kind of protects our vein from giving maybe caustic medications, protecting our vessels if we're accessing them a lot. But because we're so close to our heart, we essentially have a kind of a access point on our outside our body directly into our heart. We want to prevent any entry of any pathogen through that catheter into our heart, because that'll lead to systemic infection, big complications, life-threatening complications. So we really need to know what is appropriate, what we're doing, make sure we're very comfortable every time we're accessing a central line. So it's true that we're going to change that dressing every 5 to 7 days, or when the dressing is soiled, or when that dressing is impaired. So if there's any frayed corner that's kind of allowing air to get under the dressing, it's soiled, it's wet, it's not adhesive anymore, something doesn't look right, we definitely need to make sure and address it and intervene. What we see in option 1, assess the CVAD insertion site and dressing once every 24 hours. This isn't frequent enough. So you definitely need to assess it every single shift at least once, and then also every time you access a central line. So anytime you're giving medications, hooking up fluids, anything like that, you need to look at that central line, make sure everything looks right, everything's flowing right, your lines are open, all of that kind of stuff. So that is a very true statement. Or that is not a true statement. What I said is a true statement. Option 2, disconnect the IV tubing from the central line when changing the gown. We don't disconnect tubing unless we're changing tubing or we're changing the dressing. So we definitely don't want to kind of just frequently access and deaccess the lines on a central line. That's another entry point for pathogens into our central line. And then option 4, scrubbing in a circular motion. When we do our dressing change, we want to scrub pretty vigorously, but we're not going to use alcohol, we're going to use chlorhexidine. So we're going to make sure that all that bacteria that's living on our skin, it's not getting into our central line. So again, our correct answer is option 3, changing it every 5 to 7 days when the dressing's soiled. Make sure we have good protection from the outside into our central line. So you guys did great on that one. Well done, everybody. As always, thank you guys for joining us. We hope you'll check us out at uworldnursing.com. Follow us on your favorite channel, and be sure and come back tomorrow at 11 and 3 for more questions. See you next time. Bye.